Bismillahi Rahmani Rahim. Allahumma salli ala Muhammadin wa ala ali Muhammadin wa barik wa sallim innaka Hamidum Majid. Famulem Assalamu alaikum wa rahmatullah wa barakatuh. This is Ahmadiyya Muslim Radio on FM 91.7 from our headquarters the Bookfields inside Freetown. Safe with the broadcast live on we YouTube channel with our audio video section AMJ Sierra Leone. I want to use this opportunity for welcoming you all to yet again another uh, episode of the program where we titled Health Awareness. Health Awareness na well body program on this fine frequency where they tell we about well body business. And most times we can get well body people them or student them with the na the well body field for can tell we about well body business. Most times we can select a topic for day we can discuss, and at the end of the discussion on our way the listen we or the view we ubanda can get opportunity for make una self go get una say na the program. So you will just join we, you can ask questions and make suggestions. Inshallah, we will take them on board. Today, inshallah, we will discuss about Jalsa Salana Medical Center. As we all know, Jalsa Salana not there too far again from we and well body. Now one part the issues them we get plenty for do with the Jalsa Salana arrangement. So for talk about well body and Jalsa Salana business, now the studios get we brother Khalid Ahmad Tamu Sahib, we na a students from the Kumas, also medical students Kumas. So brother, Assalamu alaikum warahmatullahi, welcome to the program, sir.
Jazakumullah for the invite.
And Seth, the one we they in charge of the medical aid, Charles Salana Sierra Leone, and go join we remotely, we na Dr. Munir Kamara Sahib, na yana the Nazim medical aid, Charles Salana Sierra Leone. Like I say, you join we remotely, and inshallah, it will be the first one we will talk to. May we the moderate this program for today. We step in for we brother Malvi Muhammad Maurice Kamara Sahib, on a brother in Islam, Molvi Hassan Sise. So like I say, we go talk about Jalsa Salana and well body business. So those who get questions, when get any concern concerning well body business doing Jalsa Salana, please when I left on our questions them. Inshallah, the brother then at the studios, and inshallah we'll also reach out to Dr. Munir Sahib for giving more updates on the Jalsa Salana and well body business. So as it is now, we go and reach out to the one way they in charge of the Jalsa Salana Medical Aid when Dr. Munir Sahib, inshallah, I go join me online for make it go get in say on the program. So on the line now, we get Dr. Munir Kamara Sahib, we Nadim Nazim, Jalsa Salana Medical Aid. Assalamu alaikum warahmatullah, Dr. Sahib. Welcome to the program, sir.
Zakala, thank you.
Yeah,
Thank you for including me.
yeah, Jazakumullah. Dr. Sabu Tayyib Baku, thank you for joining the program. We all know the forthcoming Jalsa Salana not too day far from we now, barely 2 weeks more, inshallah. We go all converge na bow and well body business gets plenty for do with the Jalsa Salana arrangement. So you being the Nazim Jalsa Salana medical aid. So you could tell we waiting at the plan for this year for the medical business or well body business doing Jalsa Salana.
Yeah, Zakala for for including me in this very important discussion.
Naam.
Yeah, first of all, I think I've been getting discussion with Ami Saab. If you want to actually organize ourselves into a team where we're able to actually work not just for Jasa but also for the Jama'at in Sierra Leone as a whole.
No.
So and basically in that line, so we began with first meeting with Amin Saib back in our office.
Yeah.
So after during that meeting, we make a few things there where we need discuss few things that we need to do. But our main focus not being on Jasa where they got because Jasa that time they not be there too far.
Naam.
So we don't set up this Ahmadi Muslim Student Association.
Naam.
And Alhamdulillah, we now have quite a few members in that group.
Naam.
And also, which I've been do, I've been phone people there, ask people there when they're available to work. So Alhamdulillah, up to date we don't get up to 18 people where they volunteer for SAP and JASA.
MashaAllah.
So for make sure the workload is shared evenly, we actually make it into rota system.
Okay.
So the rota run from 9 to 4, 4 to 11, and 11, and then overnight.
Okay. All right.
So then we start on Thursday, inshallah, and myself and then some other members will do it on Thursday 4 p.m. Now they start because that day a lot of people can come. And then so and so a lot of people don't sign up. So we don't put about 3 people in each shift.
Okay.
And then so we will make sure say the medical camp is covered all throughout the night. The other thing also throughout the day and throughout the night. The other thing also what we don't organize is we think we get resources, we'll be able to do a lot. So one of the brothers, Mr. Abu Bakar Kamara, where the boy when I say show get your clinic, if you don't donate some drugs then the rest of the other medications that we will need, myself have to go pay for them at the pharmacy. And then I will don't talk to some people, then they don't give you some equipment they will need. So we don't get almost everything we need really. Just the personnel that is the medical personnel and also the medication.
All right, sir.
So now we did so far. And the other thing we'll do also is that this year we want awareness, let people they know for say not everything medical problem we then get we will solve. Now,
because now very good points because that one lead me to my second question. Because most time Jalsa Salana we concentration more now on the spiritual aspect of them, but sometimes also we can get some medical emergencies where it can come up. So one go on for no now like which kind medical services when I get for render during the Jalsa Salana.
Yeah. So before I answer that question, we send off a flyer by one of the brothers then Tahir Songo. Set off a medical flyer where inform all the Jama'at for then they send out to all the Jama'at to inform them for say the only all the people then where they get on medication for chronic medical conditions like hypertension, diabetes. Then people they not forget for bring them medication because we not get them kind of medication they did at the camp.
Okay.
We camp they only cover medical emergencies. Somebody will present with fever, for instance, we also say maybe na malaria get or maybe na typhoid get, we'll be able to treat them. If somebody will get diarrhea, we'll get something that will be given. Or somebody with blood pressure really high, where dangerously high, we'll be able to get some medication for just blow out down with advice which you for do.
Okay.
You see, so because be very close to JASA, we'll not be done prepare leaflet yet to give people there with regard to medical advice with for do.
Okay.
You see, so but subsequently by the grace of Allah we will organize with us that we will do that.
Okay.
You see, so the only thing we will attend to if somebody get suspected get malaria or somebody get chest infection, get antibiotic for that or infection of any type. Or somebody get maybe malaria or typhoid, we'll be able to treat the one. Also, some people they can get some accident where they can get bruises and other things there or burn.
Okay.
So, for some people they didn't work in the kitchen, sometimes they can get burned.
Yeah.
So we get a first aid kit there. We will address them today.
Right.
So we will only do first aid, and then if that person they really need further treatment, we actually advise them to go to hospital.
Okay. Yeah, the other area of concern, because Jalsa Salana most times can be attended by both Lajna, Maila, and also the Mandem, Kodam, and Ansarullah. What's not the plan in this aspect? Is it that now one side everybody gets medical attention, or there is a plan for divide them so that maybe the woman and they separate and self the man and they separate? I don't know. It's not the plan.
Well, I mean, sir, the specifically instruction we forget the both way actually for the men and women keep them apart.
Okay.
So in that respect, the both way they give it divide into two sections.
Okay.
One section for men and another section for women. Even the queue where they line up, men they line up one side and women they line up the other side.
Okay.
But we try also to get as many female on board as possible so that people that would prefer female to go able get treatment, but that do not guarantee always.
Okay.
Because of the fact that majority of members up to date they are men there.
Okay.
You see, so that they will not do. So yes, a separate section for Latina and separate section for the man there.
All right. So those way they listen, we possibly get for attend Jalsa Salana go on for know the location this year on the Jalsa compound. Who say the medical center go day for direction?
Yes, the medical compound is located you know, the small corner there between the primary school
Okay.
and I think the junior secondary school.
Tahir. Okay, Tahir.
Yeah, Tahir. Yeah,
Okay.
and that small corner there one day we did. So where
Okay.
you come on, because I'm not too familiar with
All
the
right.
layout of the place itself. I
Okay.
just give brief.
No
So
problem,
when
sir.
somebody enter, where you can the car park there on your right, on your left,
Mm-hmm.
and then you go straight. Where they go straight, you get some building there on your right. So
Okay.
now that small corner that they would do.
All right, sir. Jazakumullah,
So
Dr.
if
Sab.
somebody
Yes.
get
Mm-hmm.
if somebody get any problem, obviously they get any utiba they keep ask around, they could tell you, but we not hide.
Okay. All right. One final question before we go drop the call. Now, whose advice you could give for those who they travel for go the Chelsea Salana? You know, sometimes they can advice we say those who get medical conditions and for take along them pills and medicines. I don't know whose advice you could give in this respect.
Well, yes, very important if you they travel, get your medication with you. Number two, because of the heat at that time of the year, some people then the heat came, which about for make sure say you get enough of fluid for to drink.
Okay.
And then some people when they get some respiratory conditions like asthma.
Yeah.
When they in the crowd like that with a lot of dust, then they could affect your asthma.
Okay.
So if you get medical condition then like that, so you go find really if you could find some place, I know it's difficult
Yes, sir.
situation, but you try as much as possible to actually avoid this place, and also get your inhaler with you.
Okay.
Some people then they get asthma, then get some medication where they take for them. Make sure say that medication is with you.
All right,
if you
sir.
see say you symptom that they get worse, please go now we camp immediately.
Okay.
We might be able to help. We may be able to give some help.
All right, sir. Jazakumullahu khairan, Dr. Munir Sahib. We tell you Boku. Thank you for talking to me. Yeah, assalamu alaikum warahmatullah. All right, that's Nabidin Nazim, Jalsa Salana Medical Aid for this year's Jalsa Salana 2026 na Bo, and we just do here for ma'am how preparations don't they go on and the kind of facilities we then go provide. So we continue with the brother here, Khalid Ahmad Tamu Sahib. We now a medical student from Commerce and Self. They part of the medical arrangement in the Jalsa Salana way just they come. Khalid Sahib, we just don't talk about the preparations. Of course, we own as a medical team when they put up for welcome this year's Jalsa Salana. Now the Jalsa guy and the kind of facilities we will make available. Dr. Sal don't spell all down there out clearly. So the other question we got in our person in mind, those we go now this medical camps or now this medical center, what will be the cost if there is any cost attached to any service owner will render during the Jalsa.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله وبركاته. Jazakumullah Mobisa for this wonderful question. I'm very sorry, my voice is somewhat shaky.
Okay.
I experience some cold. However, I feel say, as those have say, we don't work on structuring the first ever Ahmadi Muslim Medical Association
purely
So
Amadis.
Amadis, that means it broaden that fact answer question only the premises or what we do.
Okay.
In that category, we have doctors, CHOs, pharmacists, nurses, lab technicians, every category of medical personnel within the Jama'at.
No.
Now the vision of the we honored Amir Sahib, Maulana Amir Alhaji Amir Musa Mewa Sahib.
No.
For say we get that structure na the Jama'at and Salon.
Mm-hmm.
We dey see say always Ama, in short Ama UK, they always can Salon can donate to we can do free surgeries and everything.
No.
Wetin Ama Salon will do. That was Amir Sahib's always vision.
Okay.
And again, the bridges for see how we dey able to mark between the medical practitioners and the student them, because it look like it is tend for provide kind of mentorship for the student within the program. For example, you get student with medicine, you get Amadi doctor within the field. It's very important that the doctor within the field provide space for mentor them student within the profession so that they can provide support when need arises.
No.
So you get nurses within the nursing school, you get lab technician, you get pharmacy students every day. How can we mentor them? So the vision of Amana for CCA we provide medical facility to people in the country and ensure we will also give out to even mentor the student that we provide every Saturday.
No.
Now to your question, the services we provide now this medical camp is no cost.
Okay. No cost attached.
No cost attached.
Mm.
Like Dr. Saab say, this is the first time where the Ama don't try for ensure say it provide support to the Michel Salana.
No.
And the past years now be on Jama'at funds.
Sure.
As Dr. Saab said, the first time we Ama
Okay.
don't say we need to take Jama'at funds. Everything we are doing there is Ama funded.
Okay.
For Ama members, like we say, brother Kamara Saab, when I was the retired CHO, don't give a lot of stuff. Dr. Monir Saab, when I in charge for the AMA for now, and also the head of the medical camp, don't also provide some financial support to this process. Also, the Tamu Saab, the Kenama, for the American Kenama Hospital, Kenama, don't give material also we go support. That's the kind of spirit we try to galvanize at the AMA, that we not only provide service to people, but also try to see how we use our own resources for push this go before. Because Jama'at's funds are limited across the board.
Sure.
And if we all say all departments need Jama'at money, we all go Jama'at money, and just another money, it can meager. Sure. It's very the food are the biggest side money they go. All department money.
Budgets don't increase
every year. So
sure.
if we say we self make a camp with it, we'll take from that money 10, 15, 20,000 buy medicines. We know they do justice to it as Ahmadis and also we know help Jama'at for growth. So in that case, it is no cost attached to it. Okay. However, there are restrictions in terms of medication, as those have they say. We don't able to give you full dose pack.
The case I just first aid for
first
just
aid,
stabilizing at that moment.
Center. It's center of emergency. And again, as I say, we are only responding to emergency conditions.
So how would they handle that emergency in case something happens?
Well, let me get a mix of team, get nurses, doctors, pharmacists, and what they do. Okay. So we say clearly enough, let people know this and let all missionaries across the board share just with the member there. Okay. That unlike the previous year where we go make long queue for say no more pre-medicine it's not the case this year. Because we are running on a very low budget also. That means we only provide to them the way they really need them. Okay. But we have done the work for 2-3 days, we get headache, you go there for headache, check your pressure, we do vitals, vitals very important. The issue with the camp we very nice or funny is in the past for me, we don't do it for the past 5 years, is that there are people where they get a condition medical, we don't even know what I want this they get them. Diabetes, hypertension, and many more. So these are two common we can able address look at always. So we can always everybody go on the camp will do for you vital checks, temperature, do you check your pressure, check your sugar, depending on and for just know understand what to make you present with the current case we present with. So however, like I say, we're not going to forget all my medication in that place. Okay. We're above 20,000 or more. It is purely for emergency conditions. And those we need them. Those we need them. Plus, get severe fever, severe heat that, belly run, because we eat food way and we change, we change environment. That's how they drink. Water and all that. Problem or burns, you wound, you cut yourself. These conditions we can provide attend to, so that we will manage small resources with the for able address. In the previous years, when we get larger resources, people know say You can do 4 5 hour long camp, long queues. You can form to see everybody and check them. But that not means also if you get the feeling of condition, you need it is because we say we know everybody suppress them. Still go to the center. It's running 24 hours. You get 3 shifts: morning shift, afternoon shift, and the whole night shift. So whatever condition, like last year I've been at the camp at night also, we had 2 critical cases that came. One man be into a very convulsion state. So with Jama'at support, we get people taken and go to hospital, be able to help. And today they are very happy. They're from Gloucester community. Happy Jama'at members. Always they see they're happy for Siri. So I feel like we are always there because outside people then you cannot overrule medical emergencies.
Sure.
They get heat past mark, the dust go day. Then the food, the water will drink, the change, and even the long travel, they travel that long travel for so much 1 whole day. That's done. You get fatigue and everything will hold you. Even though the conference in blessings can also get kind of spirit and motivation for like you the we need also overrule physical abnormalities will happen.
All right. It is good you don't make mention of the services provided there could be free of cost, of course, like I don't happen previously. And secondly, because almost every department at the medical field get for the day, different specialists and get for the day. So responding to emergencies, inshallah, no could be of much concern. Now the other area, whose provisions, like if at all wanna put in place for the elderly women and children, most times, well, I know we say the man they not can become affected, but these are categories where I wouldn't know the word they can use. There's one word. Well, they're vulnerable more most times. So I don't know what provisions for these categories of people during the course of the Jalsa Salana.
So medically, emergency conditions are graded by your presentation. So
not necessarily gender
or whatever.
Or age.
So you have in standard protocol you have triage where you sit down and they scrutinize after they take vitals. So for example, if I check vitals Mobisa, I check vital at 38.5.
Okay.
And woman cow at 36.5. 36.5 is more normal.
Okay.
And you are more at peaks of something than her. So and again, if the couple be unconscious, there's no way we'll say we're not always conscious. You are secondary to us at that moment. The post with the count that states the the primary focus.
Okay.
Because when are conscious, when work for herself, you did walk in visit to the facility, unlike the way they bring in.
Yeah.
So it's about the condition again. So we don't just say specificity for gender and beginning. However, the way those apps say we get woman center, man center, and we pray that we get people we get doctor with a woman who are available for them service center and still able to deliver on that day.
Okay.
But just normally in case the only thing I will say is that the vitals we collect, they help for understand the kind of condition we present and the importance of her. If the condition we like I just say in the clearing of that, the person we they carry it, then you they come for yourself. Now two different conditions. You they come for yourself, you are now you they come say belly heart, belly run or maybe heart. That one belly being some kind of belly will hit you. Bro, they put you as priority number one than other people. So everything is created by how you present yourself in this condition. And also the vital sign will tell we say this is the condition. Once we be say initially now that where those are they say we're not going for do everybody, it's true. However, there are people working on at the conference, the not even when the status in terms of the high blood pressure.
Okay.
And we cannot give you full dose pack for say they give you all the treatment for the 1 month or whatever. We can only give you start dose depending on how you present and give you advice to follow up with your medical center where you return at Jama'at.
Okay.
That's what we can do as more advice to the other way that
yeah, waiting would discuss so very much important and it will also it will be of use actually if most Jama members then will like get a wind or get some understanding about what we discuss in terms of who said them go for get medical attention and when they forgo the now which kind of situation for prompt them, for good day. So like disseminating this information right across the country or at least certain quarters so that people can go get this awareness is very much important because if during the course of the Jalsa Salana somebody gets some kind of emergency, I don't know who side for go, I think it would be a serious challenge. So I don't know as a team going there Is it that una go put make a sticker, una go make announcement, or whose strategy una go make at least let person know say if I'm going there, I get any medical emergency, I know exactly what's happening.
So thank you for bringing that to our notice. We try to put up a clear memo flyer out. We go able for tell people about the service we render and direction to the place.
No.
Secondly, I'm sure inshallah when we do the welcome Thursday when they do welcome announcement them. These are something to go push for let us announce. Let people know say the location like wait those they say. So when you enter Tahir Gate, between Tahir Gate, the small gate to the primary school, there's an open space there, by that big field. So normally we'll be there towards that pump,
Yeah.
towards that pump and that primary school. But when you move towards Tahir Gate, that small gate towards the primary school, I didn't know the center there. So again, inshallah, we'll likely will get medical team members. We will do education and announcement, and we'll also go to Kudam there because these are people really at every given point they will provide security for different sector. So work with the Kudam there for let us say be vigilantes for we and be maybe medical volunteers because if possible for them at that time if not bring to be early, we hope it will become very late for attend to that person day. Then I sure inshallah with the plans we'll be get banners or posters or something for showcase say that's the point because it's very important that let people understand. But funny about medical center, you know hard for Sabi.
Yeah.
And finally, I see more people that's done it, they get stethoscope on the neck or they get glove there.
Everybody gonna
so
say
say,
go.
I never go.
All right.
Just that we still need for, like I say, is do pre information and clear. The issue we emphasize on now is that we are not doing generalized screening for everybody. Let people know that they, and you will get you medicine, we know say you did on pressure medicine before. These are a matter of faith and truthfulness to yourself and to God.
No.
You know, say me, I may be at pressure business, I manage my blood pressure, or me that person we get diabetes, or me that person we normally they get hit with this kind of sickness and the asthma. Please take your medicine along.
Okay.
Me, I get 2 bag I lock with. All 2 of them bag give me medicine while they travel with. All 2 bag from me anti-malaria to me Cipro to me paracetamol, me Novogen. And again, maybe for other people, even that metro for Umbele.
Okay.
Somebody will go see us still go need them. So if you know say you get a medicine where they travel with, please always make sure say they with you. For you or for the next one going near you.
Okay.
But because the idea about medical camp, Saloma will all want free thing.
Now that I want to ask because people that don't use whenever they announce for medical something, they see a very long queue.
Yeah.
So how prepared are you for handling kind of large crowd in case because they don't get this notion already before? Well, every dialysis salon we can see that long line, and now you are saying this time around, well, and always say now they discourage beaucoup people, but at least now they prioritize those who need them at most. So how not go? What's are the plans for handle such kind of crowd?
Unfortunately, it didn't happen last year. We didn't have medical camp last year.
Okay.
Because these are the body we they get for handle. We thank Humanity Festival Leone for the good job we don't do for you before.
Yeah.
But like I say, there are medical items ready to address those conditions.
Okay.
We know the fear people that forgot at the center. We just they say for all nuggets, we are prepared manually in terms of human resource, we are prepared in terms of medication and even screening. Again, you can't tell me say this is my problem. And if you say you don't left medicine, now you ain't got no we'll still give you if it's available. If not, then we can give you prescription. Because we work also as doctor of advice.
Okay.
So if the medicine will forgive you no day, we try for still give prescription for buy the medicine in the pharmacy with the outside just alone.
No.
Because we no go left and a guy will say so the vital signs where you they come with and go guide we. For example, for say this man dey in the kind of condition. So sometimes if you can't say if you can make them up for say you get the condition, they don't get the machine no wipe away.
No.
BP go check, will say this na lie or the temperature will say it's not correct because these are machines where you need bribe them. Unlike most people will say, hey, we'll $5 in free medicine.
Yeah.
The machines that they guide you for so if the BP pressure is normal, your temperature is fine, and if you have condition where you go to belly, will you metro and some other method drink for go sort yourself out.
Okay.
However, if there are conditions we want to get medicine for, we still provide vitals which is free. Check your status. 2, also check for malaria because then kids and they would procure. Forget checking malaria status for sick malaria day and forget advice. If it's severe bio control, they go to stop say, they provide referral to the government hospital where go need for support the process. However, for us to say we get people in wellness,
Okay.
not just Alana, inshallah. But
Alright.
for the crowd, we are not expecting less.
Okay.
Previously, we used to manage up to 2,000 more people.
Yeah.
From the
Throughout the 4 days, I would say Thursday,
from
Friday,
the
Saturday, and
last time
Sunday.
I was there was 2023,
Okay.
2024. We had up to
2,000 people.
2,000 people we saw
Okay.
at random at different times.
Okay.
We may be looking at 3,000 or more,
This year.
given that
The number don't increase.
and whatever we look at, health is something we monitor grab today. You well, and let you see.
Yeah, possible.
The net locally, you see, yeah. So it's just that way that health is not static,
Okay.
dynamic to many things, and as you dey change environment, even the air get wake act upon you,
Sure.
even the motion, some man get motion sickness.
Okay.
The long travel get motion disease, they make even throw up. So security is a fear. Most of them don't be fear per se, but
Okay.
you get the physiology of the body where it means say once you are moving constant, you are moving where you don't stop. They get some. I don't want to go to big anatomy for COVID, but
Okay.
it's like once you're moving emotion,
Okay.
they stimulate all the center for you belly for beginning to throw up and whatever.
All right.
So again, I advise the missionaries, the travel people, them also doing the health workers, when sack you, they forget some medicine the way they help them people they for them travel. So man can get that notion, forget hey, suck that I mean, suck this, suck that. Whatever works for una, if you say healthy for una,
Okay.
me no they say so. Just be clear on that. What if they work for una, for keep the people healthy for calm is good.
Okay.
Again, I go say doing long travels, please try to have breaks. 5-10 minute breaks. People stretch their food because the tail is not for long, not tight
and all
and the nerve, the blood vessel, they give for the constrict, give for the fold, give for the muscle, the twist. Every 2-3% don't join together. So them invest with them artery and vein and the nerve, and very small thing within the small compression, they make you numbness. You get that thing, you go become whatever. So Leone conference, blessing, we can't get physical. So if you long distance you're covering, please drivers and missionaries tell your drivers break for 5 minutes or so. People come down, let them just stretch your foot, walk out for 1 minute or 2 minutes, just walk distance small, then blood circulate again. Because it's not like a pipe, the blood is like a pipe. Once you block and by the different road, other road, never water side, block and they cause trouble, and that constant
we're not passing normal road, no problem.
So either begin leak or begin other issue go happen. It's maybe people will go happen.
All right.
So for you not can't get foot problem all MP, please try to get some short breaks during
along the way.
1-2 hours for make people fatigue. For that like more Kabbalah part then now then
far distance.
Please look at them breaks on the way. And also prepare safety measures for emergencies and other things will happen because you cannot tell what happen on the way.
Jazakumullahu khairan. Thank you. A quick reminder to those with the viewing on the YouTube channel, audio video section, AMJ Sierra Leone, and possibly serve those way they listen through the online radio. That today we talk about Jalsa Salana Medical Center, and earlier we don't talk to Dr. Munir Kamara Sahib, we Nadi Nazim, Jalsa Salana aid, medical aid doing Jalsa, and at the studios we get Khalid Ahmad Tamu Sahib, medical student and serve part of Ahmadiyya Muslim Medical Association. Is that?
Yes, sir.
Yes. So we talk about Jalsa Salana and well body business during the course of the Jalsa. So in case you get any concern, any question, please definitely YouTube channel. We will read them at the end of the discussion. And inshallah, Dr. I want to before the gun, Khalid Sahib Day here for inshallah work motto on all the questions and the way we will receive. Now, Khalid Sahib, we also look at disease prevention during the course of the Jalsa Salana. We all know Jalsa Salana attract thousands of people from across the country and even beyond. And most times we can cluster on one side. So I don't know how not able for intervene or within as the medical team will not go for doing these slides when it comes to disease prevention during the course of the Jalsa. Are there any plans to that effect? Or
well, we may not be doing that right now.
Okay.
However, I can provide some advice across the board for the people that know say Also, you write stop as an individual. Now then the next man you write start.
Okay.
That means we will try very hard for ensure say we provide regular care for we health,
Yeah.
regular care for we well body, regular care for other things that will make the just like more fine. I feel say we need for always the try for see say we provide regular information to ourselves. That means say like littering.
Yeah.
You get bathroom facility we available now just
Yeah.
another.
I would beg like you broke some of them what they done.
Littering mean for trade dirty
Dirty
outside.
around. So for the layman,
So
they go understand.
so when you dey trade dirty every side make the place unconducive for the other man there.
Yeah.
And again the issue of what they say bathroom dem specific dey na just alana wey you use. Bathroom for go use get side for wet, side for go yard, side for was. So most times notice that people just can just was all kinds of no more.
Yeah.
If we don't see yana for was, yana for do this, yana for do that, day, people they can just go no more they was because of the feel say they need for do that. Day.
Okay.
So I feel say very important for them to understand say then specific side we don't give it for them we use for bathroom, for go yard or for wet, for use them appropriately and well so that because if we use the side we not for use, we they create an unnecessary inconvenience to the other people and they will mean say it become toxic for the health.
Okay.
One. Secondly, I feel say the kitchen staff and in the kitchen need for also put adequate time for put prevention for the new well body business. Once you dey constant inhale this smoke, it inhaler it gets way for affect you self as an individual. And I also advise the head of the kitchen for them ensure say they get rotational scheme in place whereby one team no go dey smell for long hours because it's not easy for like one team dey cook dey near fire for long hours. So important for them to get that kind of thing in place. Wey mean say if they don't go mix rest this trip 1 hour, then the other so that we will forget rotation in the place because if you dey get one team they do very long hours like I say just not just as I say for the show of the traveling. You dey get the same condition again that fatigue go dey inside.
Okay.
Go fatigue, you go become tired, you go see you go begin to exhibit some signs of other condition the way they make the person begin even burning.
Yeah.
Once you tire you begin to feel the fire you deal with that energy wey you use for mix that rest dey go no go become appropriate for you and at the end of it you go possibly left for the one they chap they go mix bad way.
Yeah.
Wey you wound you burn yourself. So other sector then the way they try in terms of prevention and I just know more we able for because we know they expect for the we go propagate. The other thing very important now constant hand washing abilities.
Okay.
Where we no go able to say this year we go do them. However, in subsequent years I know say the armor go work on strategic point there for wash hands and travel to see because the other shake will get the normal shake was a hand and hug and whatever. We not currently in a state of emergencies for say we need to get face masks for condition landing.
Okay.
And if we know they expect people for be cigarette smokers.
Okay.
However, a social lifestyle we will refrain from. But if you feel you know comfortable for doing, if not doing okay, because we get Amadi and non Amadi we as invitees, please also encourage them for doing in a space we no go inconvenience other people there. Because some man way this they affect them. If you get asthma, you choke them quick down tormented. So I feel say now it can just start. Also you right stop, now the next man you right start. So waiting they go do you not go convenience you, go inconvenience you, not down to the next man. Chef was say you for reduce the burden. And for walking to a dirty all side just salana. All times drink that in bash. This bash, that is bash. All able regulate them. The blessing of the just salana is not based on few people.
Okay.
It's not for all those who are assigned to work. It's about we all go there. Even the act of you taking that one way drink by and you know 2 and a blessing for you.
No.
But if you say you just do more for say you go and do things because you have to do you know they help the system for grow. You also know they help the Jama'at for progress.
Okay.
And you know they help yourself as an individual for let you gain the blessing of the just salana.
Okay.
So I think this is some 15 we are going to promote for issue of prevention, holistically personal hygiene for yourself and for next period in the and keep this place decent and neat at all times.
Okay. I know they talk about Jalsa Salana now and we all know well body very much key, and any way to keep people gather. Most times we will be very careful, and especially in terms of hygiene, like I said, hand wash, the restrooms, and the wash facilities. These are all things where everybody will go during the Chelsea Salana for be mindful of. Like I say, when I just starts, and now this time around, exclusively those where they into the medical field, now they come together for this year and say, well, we are going to support the agenda of the Jama'at and especially provide medical facilities during the course of the Jalsa Salana. I know with time, maybe una could build on that day more. So, like, waiting on some of the innovative things I want to feel say it were ideal for the Jalsa Salana when we look at you know medical facilities. And the other thing, this part of the world, we get a lot of medical issues, medical conditions, So along that line, I don't know what is the intention and plans going forward for Jalsa Salana in the future.
So, Alhamdulillah, for this year, over the years, we have been treating patients based on just classical presentation, what you can foresee, and this the one and me.
Okay.
For the first time, we try to see how we work on investigation. That means if we don't plan for say, we'll get if you come with some presentation, like malaria is something we come on to one as alone.
Now,
So with the plan for say we're able to test.
mm-hmm.
So this is for the first time we are doing those things.
Okay.
For picking out some kits then for do some random tests then we just to get an insight as to what is your presentation you are bringing.
Okay.
So not give you drug we go harm you. Because medicines are all chemicals that have been made and they can be harmful if taken uncontrollably or unregulated. So that means uncontrollably means you know you're not drinking, but medicine is not sweet, it's not food. Even though once it for free, but it's not food.
Okay.
If it's not even the paracetamol they take so can be harmful to you. The common paracetamol will say, come on, Oma,
if you don't take at the correct
give
time.
paracetamol, take no paracetamol, it's harmful to you. Last week I had an experience with medicine myself. After morning I get a condition why they take medicine for. I know you told I take the medicine. I just use for say I don't eat something in the morning. I drink water, but I don't drink. That day I just grab a little class. Now I take the tea I drink. Halfway to lumbling, I begin sweat. Okay. Hey. Started sweating. I started sweating. I begin the belt. Why the belt? The medicine made me the belt.
Okay.
Later after some time where I feel the body don't begin fend, the agent never help me for stabilize myself. Now I can't too. So that's just one thing we very bad. So I feel say for let we begin to go to a level they say we can get malaria kit, sugar machine. Not been there before. These are things we innovative for we need for this trip. And also other tests we'll get. So in the long run, inshallah, as we progress, the vision of the team now for CCA we get a more bigger space camp. Because you go to the UK where now we own side where they compare from. Saturday way we actually get bigger space for mega camp where each side get your own team. So we go then take you now, send you that you go there, you see the kind like a tent, big tent. But these are our own start. So inshallah we plan that in subsequent years after Amma. Just this year Amma don't start. We'll begin take over. If we not say Amma they come bigger.
Hopefully.
Inshallah, once Amma sit down properly this year.
Inshallah.
Next year we know always see different Amma go cause inshallah. We'll be because we get beaucoup students that really
but when as a student, those who also actively practice medicine and know into the medical field. I don't know how gonna be stretched for reach out to
many we are reached out to. Many are reached out. We are still reaching out to more.
So how about response?
Yeah,
how many total would they expect? Even though you don't mention it's different practitioners and they from different fields. Yes, but so we talk about a crowd of well over 20,000. So imagine.
Right now we get 18. We don't confirm participation. That is student the way for attend.
Okay. All right.
So 18 we don't just say yes, we go delay the practitioner we few students around, we don't commit. And like Dr. be saying in call, Amma just don't start, it's just less than 3 weeks.
Okay. Mashallah.
Now this January, I think December, January, American meeting, we are now 1 month or so to facilitate Amma. So we not get that all my yet follow reach for Amma properly. The first task has been to structure Amma, but we don't still wait first. Lord do the just Salana, who don't go back to structure it and get Amma together.
Okay.
However, like I say, By the time we gather all practitioners, the pharmacists there, then they where like we say beautifully with the armor construction, you don't make get in the cast where whosoever belong to this kind of group.
Mashallah.
So if you get medical practitioner like pharmacist and student they in pharmacy, 10 of them, you can run a conference pharmacy
Okay.
where we can sell, for example, on a low cost basis. Yes. So not even say go now do again for go buy, go
come
see
inside
low
and buy
cost whatever.
from way.
That is not the part wetin na armor go do o.
Okay.
So get drugs that we very critical who no one for they even begin get out.
Okay.
Because everyone they be very classified in there. So we can still these are things in plan. You get the medical lab team we go there. So I feel say in subsequent time in the future, inshallah, we go hope for to say we get this structure, bigger structure with than the one we get, and each unit they function properly and respond adequately so that it will be easy for operate and respond to the whatever they go for medical attention.
Inshallah. Jazakumullahu khairan. We tell you boku boku thank you. We don't receive plenty messages from our YouTube channel. We will take them now and questions and day for you actually. So please you will note them down and you will respond to them. I believe some of them they even don't respond to them, but it's also important maybe go re-echo them again. We get we first message here from Murabi Muhammad Mawis Kamal Sahib. He says, Assalamu alaikum wa rahmatullahi wa barakatuh. Brothers, he say, I'm very happy for see una the discuss about Jalsa Salana Sierra Leone and about also the medical aid. He ask, he say, within na the medical aid service na the Jalsa Salana Sierra Leone and why why an important part of the Jalsa. I think they ask what to make the Jalsa medical aid important. I continue for ask say now which type of medical services and way gonna go provide to them people that will go out some medical conditions during the Jalsa Salana. He also ask another question. He say the medical aid will not go give. It will throughout the entire duration of the Jalsa Salana, even during a night time safe? That's another question he asked. He also asked another one. He said how the medical team during the Jalsa go handle serious medical cases then where go require referral to hospitals. Yes. Yeah, he asked another question. He said the medical aid it go there for free for all the one them we go attend the Jalsa Salana. Obviously, this question we don't respond to them. This Jazakumullah Morabi Sahib for all them questions and day. This one from Imam Aruna Umaru Sanko Sahib. He say, Assalamu alaikum wa rahmatullahi wa barakatuhu. He say, Jazakallah for this wonderful presentation. He say, this now the most difficult situation we can normally facing from a Jama member there, especially during the Jalsa Salana. He say it's very much important for talk about more and more. I think it talk about the medical issues them. So it's very much important on that. Goda Ibrahim Kabo Sahib they say Assalamu alaikum wa rahmatullahi wa barakatuhu. He say Jazakumullahu khairan. Yeah, he repeat them up to 3 times. Jazakumullah, Brother Ibrahim Kabo Sahib. We appreciate you, sir, for your message on the program. Brother Idrissa Sise Sahib, they say, Mashallah. Jazakumullah for viewing. Brother Mahmoud Dumbia Sahib, all the way from Bo. He said, they say, Mashallah. Jazakumullah. Brother Al Hassan by Kamara Sahib, they say, Assalamu alaikum, brothers. Jazakumullah. Brother Al Hassan Kamara Sahib. This one from Junisa Adiza Kuruma Sahib. He say, Assalamu alaikum wa rahmatullahi wa barakatuhu. He say, Jazakumullah for this wonderful program. Moses Nabi Sahib. He say, Mashallah. He say, such an interesting program. Make Allah bless you all. Amen. Jazakumullah. Moses Nabi again. He say, my question now, what if somebody get chest pain? He say, what are the things we want to put in place so that it will reduce the chest pain so that the person go safe. Another question brother Moses Nabi don't ask. This one from Mr. Alpha Din Mambo Sahib. He say, Mashallah for this year's Jalsa Salana. He said the medical department will help address some medical challenges them we people can face now the Jalsa ga. Indeed, Jazakumullah, very good one. We appreciate you, sir. The last one come out from Sister Aisata Samkin Sahiba. It says Jazakallah for this wonderful teaching. Make Allah continue for giving her knowledge. I think it's a medical student, so I will contact her for the part of the medical arrangement. So far, that's not the questions then for you and the comments them. So please, over to you, sir.
Jazakumullah, Movie staff. So we get first of all now, what services that Jesus allowed to do? I think we don't talk about that. Provide basic service for emergency care condition there. Then why important? Medical health is wealth.
Sure.
At every given opportunity, we will not go able for overrule the fact that people they for suicide travel for long distance of 5, 6, 7, 8 to 10 hours and spend 3 days there without complications. So we need to have a set of emergency. For example, we not go on for big rush people in the hospital for even a small common headache. And normally we don't people small man they use that thing for common just like mediate, mediate. So for regulate that kind of thing, very important for us to say as we are dealing with the spiritual part of the soul, we mean say the conference now for build with spirituality, the physical bag will get some half portfolio we need for tap into for let the spirit stay in full gear for pray tajud and do all that we will go there for. Um let's say the services again. We need for people to understand say we're not going to rule out that people could get sick. So just for say we get ready. Duration the way doctors have me leave be say 24 hours scheme. From Thursday we will start inshallah run through Sunday afternoon. Sunday morning because afternoon we are rushing to go back. But we'll still have morning and have medicals for maybe when they go there around. So we ensure that during the Jazz Salana from Thursday throughout morning, afternoon, night shifts, they don't make a roster. We cover health people that go there at each period of time. Follow the address and attend people that go there. Handle serious cases. So we don't say we are only doing emergency response. That being said, if person gets a very severe condition, we require severe response depending on the presentation. Which the person come with, how the person come. No, just say we just see you. No, sometimes they order a court can make you get shocked. So if you come in, you know, see this thing we will handle under emergency package, maybe which we gadget or we life skill or we gadget or we first aid kit will get we handler we can handle. However, if you go beyond we handle capability, we mean surgery conditions, we don't go to surgery either. Go to I will go check either. Not just for say people will manifest or can show some basic clinical condition where they affect them for their holistic well-being for staying like just Salana, we able for providing support. So that being said, we'll be there. So if the condition go beyond control, we get a team also we go support. Over the years, the mission vehicle they always want to help you anyway. I'm not gonna help them. So they always available. Follow just tell the MAL team they will give you a vehicle and driver, and also sometimes they can provide support financially for help we cover those expenses we can happen. That's again for emergency condition beyond we current control as a medical team. We only for go seek medical center, so we can always refer with the book government hospital and book we did able address and we can finance something. However, we advise everybody for stay healthy as much as they can. Free, yes, it's free. I've said that some people say it's free. Nobody's asking you to pay a dime for your test. That we will do if we do. If you need to do a test for your vital signs, you know, for the medicines is free. Nothing is paid for. Then chest pain, what can be done? Well, you can say chest pain are one of the current medical things that you could present with any health facility. So we know say we can explain all the things that I would do. However, present yourself at the facility, we'll do for you an assessment. After the assessment session, we'll now know do we have what he needs here? If not, we can advise and give referrals to the people there. If person go by gelocin, go by omeprazole, go by this, depending on which the constitutive agent of which they present, go for pre-M-term, like not previous years. But if you go beyond what we need for do, we are sending the hospital or prescribe you medicine for go buy for like you for become healthy during the Chelsea Salana. I feel like I don't cover most of the question
Sure,
away
sure.
anyway.
All right. Jazakumullahu khairan. We tell you baku baku. Thank you. What will be your final message to viewers and participants of Jalsa Salana concerning your body business doing the Jalsa Salana and even beyond, because now everyday business.
I feel as we go through our spirituality components of the Jama'at, we need to ensure so we stay healthy, eat well, try to keep yourself healthy. Things are hard, economy bad. So no go say eat balanced diet. Small for even eat that one for me.
Okay, what's the problem?
So try as much as possible eat basic diet.
All right.
Eat fruits. Or you get more than a village, you can get the fruits there.
Yeah.
Eat fruits. It's not just the sell all the fruits we get. Eat fruits and able to say able eat well and keep you healthy and do some checkup as you can.
Dr. Kamal also may recommend juice because
Yeah,
the
what
sun.
book water? Book water for the forget water in your hand. Yeah. If they will get the water container there, people they go like them aged or equivalent. They water then water bottle then plastic on the week 20 liters. Then couple and they get those ones water the lady with the just saga. And also they will shape water. However, get you container for keep yourself hydrated. Because once the sun penetrates, it take book water from your body through perspiration, urination, and other means. So it means you go for the wet boku, or for the go sweat, and that means then you spit the water in your body. And the body needs water for the tissue and now the body not go bad or not get any effect. So I feel say you need to get enough water in the system regularly for your body function. So please, whoever get juice, that Kool-Aid stuff not Kool-Aid. Don't make it too sweet. Mix it, get water 900 day. You get water for drink water. Anything that fluid for keep you hydrated, keep you intact, keep you water in the body. Please have those ones so that you go to any activity beyond. Then you get a medical condition, a condition where medically inclined, where they don't diagnose say yes, Khalid, you get this condition here. You get this state really affect you. Please don't forget your medicines really go with.
No.
You get ulcer, go to ulcer medicine. You get pressure, go to pressure medicine. Diabetes, they take your diabetes medicine. And also, we not go provide anything like two business for 2 person. So no go say, hey, me pass to some man again. Me no, me no, pass to go. Well, drip not the other. Drip not the day, chuk not the day. This year. And just we get basics we they provide. So no go say chuk, pass chuk and whatever. You see one chuk, go to chuk, go chuk before. You know, we need chuk in another place. Because why we are saying it is that in the midst for to prevent or help you, let us not cause more harm to you.
Harm, yeah.
Passing IVs need a very sterile or clean environment. We know the dust there that
up. Makeshift. So I don't know how the facility will look like, or we to advocate for ideal. Where I don't say perfectly. But
well, we cannot have a sterile. That's an open place. We know we'll get a hospital standard.
Idea anyway. We're not going to recommend to those way they make the JALS so that the medical side will get small elevation in terms of how one feel say look ideal for.
Well, we are late for that right now. We cannot do it.
Well, maybe for the future.
Future, yeah. I'm sure in the future we will see how they improve. I'll tell you now.
Okay.
A bigger tent and make it more sterile. It means we able to give drip there and do that in the future. But for this year, we are late. We're not prepared for that.
Okay.
We will not ask no money from Jama'at for next year.
Inshallah.
So now we see so however I'm just saying we not get money for say we go because we give drip and choke. We should be in a space we clean. We don't add germs or bacteria to the person. Okay. For get infected with other diseases there. Right. So we don't want to cause them harm on this. So please drink more water, clean up very well, to ensure you have your drugs that you are using in
do not litter around.
No litter, not just outside, just ensure you keep the place clean. And wet yourself for wet, wash yourself for wash, go ahead yourself for go ahead. And these things I'm sure inshallah and who they smoke, I'm not saying don't smoke or stop smoking, but even the box of cigarette they say tobacco is not good for your health.
Dangerous for your health.
So please now we ensure so refrain from them with the effects with.
Alright.
The more you smoke, the more you puncture your lungs and the entire system for respiration. Okay. So please try to say you avoid anything with the effect harm. Because as we go for spirituality and I believe like you say so, we need to get some health information with the go for know also. Okay. So inshallah in the next couple of years we'll get health campaigns we will do the for the people that are but with their health and have to keep health in good state. I feel like those will be my end word, inshallah.
All right. Jazakumullahu khairan. We tell you boku boku thank you. Khalid Ahmad Tamu Sahib, student from Commerce, medical student. We do we at the studios. We don't talk about the Jalsa medical aid. And Seth will be talk to the Nazim Jalsa medical aid when Dr. Munir Kamara Sahib. Jazakumullahu khairan for your invaluable insight we provide we at the beginning of the program and your every plans and the preparedness of the medical team for handle this year's Charles Salana Medical Center. I'll tell you Boku Boku thank you, sir. Sir, once a Boku Boku thank you to all we viewers and those who listen to we on we online radio and so those who left for we comments, questions and suggestions. We take them all on board. We appreciate all Jazakumullahu khairan. Once a Boku Boku thank you to all we give you technical support. We did behind the YouTube page and self with online radio. We missionary Mahmoud Hassan Mansai Sahib. Jazakumullahu khairan. Utai baku baku thank you. Me, we moderate and present this program. Yeah, me know brother in Islam, Mulvi Hassan. So the next time back, inshallah, we will come with another edition of the program Health Awareness. Assalamu alaikum wa rahmatullah wa barakatuh.